if I grow it to a $2 million practice, is that better than if I grow it to a $1 million practice? And 90% of people say, well, yeah. I mean, that's obvious. But what if your $2 million practice, you were netting $500,000, and in your $1 million practice, you were netting $550,000? Which would you rather have? Well, I'd rather produce $1 million and net $550,000. And that's where the overhead conversation comes in. Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way. It's just one that has worked extremely well for me, and I'd love to share that with you, so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast. Hello, this is Dr. Bruce Baird with the Productive Dentist Podcast, and today we're going to talk about practice value and valuations and those types of things, and how does the outside world look at our value of our practice, and how can we increase our valuation or increase the value of our practice on an ongoing basis. And so the questions I often get, and I have doctors that will call me and they'll say, hey, Bruce, I was thinking about selling my practice. Another question might be, I've got an associate and I'm considering selling the practice to the associate. And there are really great professionals out there that can do your standard, valuations on your business based upon your equipment, based on your productivity and your profitability. And those things can be put together, but what is someone willing to pay? That's a different animal. And how can I affect that number? What does it look like? And this is like, if we step back right now and said, how would this work in any business? Obviously, the first thing we always think about is sales. Okay, if I increase our sales, what we're going to find is you would think our practice would be worth more. Well, that's true. There are dental practices that are doing $2 million in revenue, and they are busting it. They are kicking butt as far as the revenue side. But they have debt. They don't handle the expense side very well. And so they're always buying new equipment. And I tell you what, I resemble this remark. I love the latest and greatest technology. And I'm somebody who pretty much had all of that technology in the office. I was fortunate that I was able to outproduce my necessity to spend money. But that's unusual. There's not a lot of practices that can do that. But as a dentist, you see what other guys are buying and doing, and you think, oh, well, I've got to have that. So you have to be really careful when you start, going out and buying new equipment. And for a long time in my business, I would buy stuff just at a meeting because the rep was nice or whoever, and I thought, yeah, this makes sense. But I didn't think of it from a business perspective. And so, we've talked about predictive analytics in the past. I did a webinar today on it earlier. And, you want to be able to predict what your monthly expenditures are going to be. And can you handle that? And can you offset? Because people would say, if I grow it to a $2 million practice, is that better than if I grow it to a $1 million practice? And 90% of people say, well, yeah. I mean, that's obvious. But what if your $2 million practice, you were netting $500,000, and in your $1 million practice, you were netting $550,000? Which would you rather have? Well, I'd rather produce $1 million and net $550,000. And that's where the overhead conversation comes in. The outside business world looks at that as EBITDA, earnings before interest, taxes, and depreciation. So they look at it differently, but then there are also some businesses that they look at revenue. And so what I've seen in the past 15 years is how things have changed in this kind of valuation market. There was a time where you could kind of look at your numbers and say, my practice is going to be worth somewhere around 75% of previous years' collections. And then you look at, okay, maybe it's over 3 years of previous collections. What you want to show if you're trying to grow your business and show more value, if I'm buying your practice, I would much rather see a practice that 3 years ago was at 800,000, 2 years ago was at 1.1, and this year was at 1.4. As opposed to a practice where if I'm buying that practice, it's been 1 million, 1 million, 1 million every year. No real growth, and the dentist will say, well, I just kind of stick with what I do. But if I'm buying a practice, are there opportunities there? Well, yep, there may be a lot of unspoken opportunity, meaning that dentist really isn't doing all the dentistry that's there, and they're just kind of keeping it going. I would look at the valuation based on new patient flow. How many new patients are we seeing? But not just that, what is the production per new patient? And that valuation for my practice, I want a buyer to know that I'm doing higher end procedures. I've got patients that we're marketing to that can afford the dentistry. We talked about that with authentic marketing. We're marketing to patients who need the services that we provide. So I'm looking at this practice to buy, and I'm saying, okay, which is the best? And I want you to be able to look through the noise. And what I said was 80%. Then it dropped to 75%, and then 65%. And as DSOs have kind of come into the marketplace and begin buying up practices, there are other reasons that doctors are selling. And so they're saying, well, if I don't have to do the business anymore, I'll take 65%, but I want to continue to work. If it's a straight sale, that's a different animal, because a straight sale, you're selling to possibly an associate or possibly a new dentist, and you're selling your practice. I'm now looking at all of these other issues. I'm not just looking at EBITDA. I'm not just looking at what the future is going to hold for me. I'm wanting to get out. And so when I look at those things, it's extremely important that we understand where we're at as far as this practice valuation conversation goes. Now, if I'm trying to grow my business, I'm going to spend money in marketing. I'm going to watch my expenses. I am going to want to increase my EBITDA or my net revenue. I'm wanting to lower my overhead. The more I can lower my overhead, the more attractive that looks to a new dentist. Or when I say new dentist, it doesn't have to be a young dentist. It could be a dentist buying your practice. If I'm evaluating that in a DSO market, very similar. I mean, I still want to have good profits. But what you can count on, if you're going to sell to this DSO, you're going to say, okay, does this offset what I would make over the next 5 years? Does this offset? Let's just say I'm 55, I want to work till I'm 60 and I'm done. All right. And the DSO says, we're going to pay you 25% of what you do, what we collect. And you've been getting 38%. Well, you have to figure, what have I been doing? That's a 13% difference. And you can figure it out. They're going to pay me cash right now, and I'm going to have 13% less in revenue. That's one way of looking at it. Another way of looking at it is the DSO is going to buy you. I'm not going to have the stress of running the practice, and my production is going to go up that 13% or 14% or 15%. So I will make similar to what I have. But you have to be realistic in what you're looking at and how you're thinking. The days of selling to a DSO and walking away, those, for the most part, aren't around anymore. And I think it's important that you understand that, because all of us, whether we're young dentists, early in our career, whether we're mid dentists, or whether we're late in our career, practice valuation is something, whether you're buying or whether you're selling, you just need to know what you're looking at. Again, as a buyer, I'm looking at, I'd like to see growth. I'd like to see new patient flow that is really good, but not just cleanings and small kids, unless I'm a pedodontist, but I'm looking for, I'm going to that production by procedure report as I'm evaluating a practice to buy. I'm looking at them saying, well, do a lot of implants. Well, I don't do implants. Okay, well, this may not be the practice for me. They do a lot of LANAP surgery. Oh, great. I've got a periolace. Or they do, in other words, you're evaluating a practice based on how you can grow it. Another example that is for I'm not going to call seasoned veteran, a seasoned dentist, that wants to buy another practice in town, as an example. And I have people ask me this all the time. Hey, I'm looking. There's another office down the street. The guy's selling. I'd like to buy his practice so that I can, get his patients. And what I look at there is I would absolutely evaluate what kind of dentistry has been being done. Have they been doing comprehensive exams on these patients and doing pretty much all the dentistry that they need? See, they may have 1,000 charts, but there may only be $500,000 worth of dentistry that needs to be done. They may have 1,000 charts and they may have $5 million worth of dentistry that needs to be done in that practice. So these are the things that I want you to think about. And there's not any one thing. It's as part of your imagination, you need to look through these things. And I'm just trying to give you some guides that you can do that. If I'm selling, what things is a buyer going to want? A buyer, in my opinion, is going to want to have either a really nice growth in the practice and show you that, hey, we're growing and this is an opportunity for you. As a seller, I'd be saying, why are you leaving? Okay, that's a fair question. Why are you leaving? So you have to have these answers. You have to have these answers, and you're growing your business. Did you just boost it up to sell? Well, yeah. If I'm the seller, yeah, that's what I did. As a buyer, I know that this practice is boostable, meaning if I come in with new ideas, new thoughts, and some new, maybe new leadership, is this a practice that I could double? Because I have no doubt that any practice out there can double their revenue in a matter of 2 years. So if you're selling, I have no question you could double your revenue in 2 years. That's what Productive Dentist does. I mean, we work with dentists to double revenues. If you increase your productivity per hour by 400, 500, 600 an hour, you've doubled revenue in your practice. You've also increased your ability to be able to sell the practice and make a great return on your investment. So, there's a lot of dentists out there that are talking about valuation. Should I sell and should I do this? And they ask me these questions through these webinars and through all these podcasts and stuff I do. What I can tell you straight up is getting involved with Productive Dentist Academy. Yes, I have a vested interest. I'm a part owner, but so are the employees. We sold 30% of our company to our employees. So we all have a vested interest in growing your business. And so if you're the dentist who's thinking I might want to sell now, call us, because we can grow your business 4, 5, 6, 800,000 a year, which is going to put an enormous amount of money in your pocket, and it'll be worth it 10 times over. If you're somebody who says I'm not sure if I want to sell, but I'd like to have a plan, we can help you with that. So these are the type of things that you need to start thinking about when we start talking about valuation. There's a gray area out there when DSOs have kind of jumped into this marketplace, and, they're very successful. They're doing very well. And we used to think, oh, it's just because, the dentistry that's done there is not good, whatever. That's not true. That's not true anymore. There are some amazing companies out there, and they've got the economies of scale. So what my suggestion is, give us a call and let us evaluate. You can, just call Productive Dentist Academy, and they will point you in the right direction. Thank you guys so much. I look forward to next week's podcast. Love you guys. Take care. Hi, this is Dr. Bruce Baird here, and I have a question for you. Do you feel like no matter how hard you try, you can't get off the plateau and to the next level of your business. I get it. It can be incredibly frustrating to work harder and longer and not see any increase in your revenue. But I do have great news for you. Productive Dentist Academy is hosting a productivity workshop on September 22nd through the 24th in Frisco, Texas, so you and your team can come learn the tools and systems you need to get your dental practice to the next level. We've been doing this for 18 years, and it is a course that you really don't want to miss. Come learn for yourself what hundreds of other independent dentists have learned. You can get off the plateau. It's just about knowing what lever to pull when you're in business. To make things a little bit easier for you, if you sign up for the PDA Productivity Workshop during the month of April, we will give you access to PDA Online for free and a 2-hour comprehensive business advisory session so you can start increasing your revenue right now, even before September. Again, sign up for the PDA Workshop during the month of April and you'll get PDA Online and the advisory session, a $2,500 value as our free gift to you. So reserve your seat. Go to productivedentist.com/workshop now. That's productivedentist.com/workshop. This workshop is already 50% full for September, so register today to secure your seat. One last time, visit productivedentist.com/workshop. Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.